Assalamualaikum and hi everyone. My name is Ainul Mardia binti Muhammad Mardi and my matrix number is 24003131. Today, I will briefly explain about lymphoma and its treatment using hematopoietic stem cell transplantation. Lymphoma is a type of cancer that originates in the lymphatic system, particularly from lymphocytes, a type of blood cell. It occurs when these cells grow uncontrollably and form tumors in lymph nodes or other parts of the body such as spleen, bone marrow, or thymus.
Hi, Assalamualaikum and hi everyone. My name is Muhammad Nasir bin Abdullah and my matrix number is 24003135. And today, I'll be explaining the common types of lymphoma. So, basically, lymphoma can be divided into two main types, which are Hodgkin lymphoma and non-Hodgkin lymphoma. Okay, first, for Hodgkin lymphoma, this cancer arises from B lymphocytes. What makes it special is the presence of a unique abnormal cell called the red Sternberg cell. These cells are large and can have more than one nucleus, and they are important to confirming the diagnosis. Next is non-Hodgkin lymphoma. This type is actually a group of different cancers that come from lymphoid tissues. It usually involves malignant B cells and it can develop anywhere in the body and not just in one lymph node. Compared to Hodgkin lymphoma, this type is more common and has many different subtypes. So, in short, the key difference is that Hodgkin lymphoma has red Sternberg cells, while non-Hodgkin lymphoma does not. Thank you. And that's all from me. Next, I'll pass to my friend for the next part.
My name is Amira Hanis binti Faizal and my matric number is 24003158. Now I want to present about signs and symptoms of lymphoma. Signs and symptoms of lymphoma can vary depending on the type and the part of the body affected. In the early stage, some people may not have any symptoms. When symptoms are present, they may include swollen lymph nodes, which may feel like painless lumps under the skin, especially in the neck, armpit, or groin. Number 2, persistent fever without a clear cause. Number 3, excessive night sweats, often drenching. Number 4, ongoing fatigue or feeling unusually tired. Number 5, unexplained weight loss. Number 6, pain in the chest, abdomen, or bones. Number 7, itchy skin without an obvious reason. And number 8, a persistent cough, especially if the chest area is affected.
My name is Chua Hui-ying, matrix number 24003183. I will be explaining about the diagnosis of lymphoma. Lymphoma is diagnosed through a series of assessments that helps confirm the presence of cancer, identify its specific types, and determine the extent of disease spread. The diagnostic process usually begins with a thorough medical history and physical examination. Healthcare providers assess symptoms such as painless swollen lymph nodes, fever, night sweats, unexplained weight loss, fatigue, and recurrent infection. During physical examination, the doctor checks for enlarged lymph nodes in areas such as the neck, axilla, and groin, as well as enlargement of the liver or spleen. Blood tests are commonly performed to evaluate the patient's overall health and detect abnormalities that may suggest lymphoma. A complete blood count (CBC) is used to assess red blood cell, white blood cell, and platelet level, while elevated lactate dehydrogenase (LHD) level may indicate rapid tumor growth. Liver and kidney function tests are also conducted to determine organ function before treatment begins. In some cases, viral screening for infections such as HIV, hepatitis B, and hepatitis C may be required. The most definitive method of diagnosis lymphoma is a lymph node biopsy, which is considered the gold standard. During this procedure, all or part of an enlarged lymph node is removed and examined under a microscope to confirm presence of lymphoma. This helps differentiate between Hodgkin lymphoma, which is characterized by rich Sternberg cell, and non-Hodgkin lymphoma. Additional tests may include bone marrow aspiration and biopsy to determine whether the cancer has spread to the bone marrow. Imaging studies such as CT scan, PET scan, MRI, and chest X-ray are used to identify the location and spread of lymphoma. Furthermore, immunophenotyping and genetic tests help classify the lymphoma subtype and guide treatment decision. After diagnosis, staging is performed using the Ann Arbor staging system to determine the disease severity and plan appropriate treatment. Next, Umaira will be explaining about the management of lymphoma.
Assalamualaikum and hi, my name is Sharifah Umaira binti Said Nozaidi and my matrix number is 24002988 and I'm here to talk about management of lymphoma. So, management of lymphoma are divided into two parts which are for Hodgkin's lymphoma and non-Hodgkin's lymphoma. Then, we start with medical management for Hodgkin lymphoma. Treatment of Hodgkin lymphoma is often highly successful and largely determined by the stage and whether the patient has bulky disease or specific symptoms. For early stage, we start with radiotherapy as this uses high energy beams to kill cancer cells in a localized area. Because early stage Hodgkin lymphoma is often confined to one or two lymph nodes group, targeted radiation can be very effective. Next, for advanced stage, we use two kinds of treatment which are ABVD regimen and BMT, or known as bone marrow transplant. For ABVD regimen, this is the gold standard of chemotherapy combination for Hodgkin lymphoma. And for BMT, this is typically used if the cancer recurs after initial treatment. It allows doctor to use higher dose of chemotherapy which would otherwise destroy the bone marrow by rescuing it with healthy stem cells. Now, you all must be wondering what is ABVD regimen. It involves adriamycin, or known as doxorubicin, bleomycin, vinblastine, and dacarbazine. Next, we move to medical management for non-Hodgkin lymphoma. Non-Hodgkin lymphoma represent a more diverse group of cancers and treatment often incorporates biological therapy alongside traditional chemotherapy. For biologic response modifiers, we have two kinds of treatment methods which are rituximab, or known as CD20 and CHOP regimen. For rituximab, this is monoclonal antibody and it is designed to seek out and attach the CD20 protein found on the surface of B cells, where the cells that many lymphomas starts. Once attached, it helps the immune system identify and destroy those cells. Next, for CHOP regimen, this is the standard chemotherapy cocktail for non-Hodgkin lymphoma, often combined with rituximab that called R-CHOP. For those who are wondering what is CHOP, it includes cyclophosphamide, hydroxydoxorubicin, or also known as adriamycin, vincristine, or also known as oncovin, and prednisone, which is a steroid that helps the chemo works and reduce side effects. Lastly, CNS involvement. If the lymphoma spreads to the brain or spinal cord, doctor may use cranial irradiation or intrathecal chemotherapy, as standard IV chemo often cannot cross the blood-brain barrier effectively. So, if some of you are interested or curious about what is intrathecal chemotherapy, it is a procedure where injecting the medication directly into the fluid surrounding the brain and spinal cord. That's all from me. Now I'll pass to the next person who is going to explain furthermore about lymphoma.
First, the patient undergoes high-dose chemotherapy. Sometimes it combined with radiotherapy. This step is very important because it aims to destroy as many lymphoma cells as possible. However, this high dose also damages the bone marrow, which normally produces blood cells. Next is stem cell infusion stage. Healthy hematopoietic stem cells are infused into the patient's bloodstream. This stem cell can come from the patient, which is called autologous transplant, or from a donor, known as allogenic transplant. And then, we have the engraftment process. The transplant stem cells travel to the bone marrow and begin to grow and develop. They start producing new and healthy blood cells, including red blood cells, white blood cells, and the platelet. Lastly, there is immune system recovery. In allogenic transplant, The donor's immune cells can help attack any remaining lymphoma cells. This is known as the graft versus lymphoma effect, and it helps reduce the risk of relapse. That's all from me. Thank you.
Hi and very good morning. My name is Nur Atika binti Muhammad Adib, and my metric number is 24003178. Today I'm going to give a brief explanation about positive side effects of the treatment lymphoma in improving patients' quality life. So treatment of lymphoma can have many side effects, especially when it's started early and managed properly. So one of the positive side effect is improved survival and remission. So treatments such as chemotherapy, radiotherapy, immunotherapy can reduce and eliminate cell cancer, allow patient to achieve remission and life longer. So second is can relieve symptoms. Lymphoma often causes swollen lymph nodes, fever, night sweats, and weight loss. Effectiveness treatment can reduce these symptoms. This can help patient feel more better and more comfortable in their daily activities. Next, treatment also contribute in improving a better quality life of patient. As the disease being controlled, patient can back to their normal activity, such as their studies, works, and social interaction. So in addition, this also can lead to psychological benefits. Knowing that the disease are being treated successfully, it can reduce stress, anxiety, and their fear. It feels more hopeful and motivate during and after treatment. In my conclusion, lymphoma treatment not only help in control the disease, but it can lead to support psychological, emotional, and their social recovery. That's all from me. Thank you.
Now I will present about the negative effects of the treatment. Hematopoietic stem cell transplantation is a complex treatment and may cause several side effects and risks. One common effect is infection, as the immune system becomes weakened after the transplant. Patient may also experience graft versus host disease, where donor cells attack the patient's body. This condition can affect the skin, liver, and digestive system. Another possible side effect is fatigue and weakness, which may last for weeks or even months. Patients may also experience nausea, vomiting, and loss of appetite, especially due to the chemotherapy given before the transplant. Some patients may develop hair loss and mouth sores, which can make eating and drinking uncomfortable. In addition, patients may develop veno-occlusive disease (VOD), a condition in which small blood vessels leading to the liver become blocked. VOD is more common after an allogenic transplant, usually occurring within the first few weeks, and it can lead to liver damage. In some cases, patients may develop bleeding problems due to low platelet levels. Long-term risks may include infertility and an increased risk of developing secondary cancer. That's all from me.
Assalamualaikum and hello everyone. My name is Nur Aisyah binti Muhammad Al-Ghali and my number metric is 24003004. So now, for my part, I will be discussing about example of recent research related to hematopoietic stem cell transplantation or HSCT in the treatment of lymphoma. HSCT is important treatment, especially for patients with advanced or relapsed lymphoma, and many research studies have shown the effectiveness. First, I will explain a study on autologous stem cell transplant, also known as a ASCT. This study involved patients with relapsed lymphoma, meaning the disease has returned after initial treatment. In this method, patients first receive high-dose chemotherapy to destroy cancer cells. After that, their own stem cells were infused back into their body. The results show that many patients achieve complete remission and their progression-free survival significantly improved. In addition, the relapse rate was lower compared to the patient who received chemotherapy alone. This study is important because it supports ASCT as a standard treatment for relapsed lymphoma and it helps to prolong patient survival. Now, I will discuss research on allogeneic stem cell transplant. Unlike ASCT, this method uses stem cells from a donor. This study focused on a patient with advanced or treatment-resistant lymphoma. These findings show that some patients were able to achieve long-term remission. This is partly due to something called the graft versus lymphoma effect, where the donor's immune cell help to attack and destroy cancer cells. However, this method also carries higher risks, such as a graft versus host disease, where the donor cell may attack the patient's body. Despite the risk, this treatment is very useful for patients with aggressive lymphoma who do not respond to other therapy. The third study focused on the reduced intensity conditioning or RIC transplant. This approach is mainly used to older, weaker patients who may not tolerate high-dose chemotherapy. In this method, lower doses chemotherapy are used before the transplant. The results show that the patient experience fewer severe side effects while the treatment still remains effective in the controlling lymphoma. This is important because it makes HSCT more accessible and safer for a wider group of patients, and it also improves their quality of life. Lastly, recent research has explored the combination of HSCT with target therapy or immunotherapy. With a target therapy or immunotherapy. In this study, HSCT is a combined with a newer treatment has especially target cancer cells. The results show improved survival rates and the reduced risk of the relapse after transplant. This suggests that combination therapy may present the future direction of lymphoma treatment, as it increases effective while minimizing harm to a normal cell. In conclusion, recent research has shown that HSCT is highly effective treatment for lymphoma, especially in relapse and advanced cases. With any advancement such as a reduced intentional conditioning and combination therapy, HSCT continue to improve the patient outcomes and quality of life. Thank you.